When it comes to personal injury, there's no better choice to call than Phil Harding. He's Colorado's best attorney from Harding & Associates. Today, we're going over some inside information, Phil, that he uses with his clients to help or make insurance companies pay 3, 4, 5 times more in a settlement. Phil, thanks for coming in here today.
Yeah, thanks for having me.
This is really valuable information.
Well, it has to do more with your insurance, and let's say personal injury, right? You're in a car accident, hurt on the property of another. I want to make sure that people know what insurance to use. First of all, I want you to use your health insurance, okay? The other side may call you at the beginning and say, Chris, I know you were in a car accident. My guy rear-ended you. We're accepting liability. Send us your medical bills, right?
That seems like a trap to me.
It is definitely a trap. And here's the legal word, collateral source doctrine.
Okay, I've heard you say this before.
Yeah, and the reason why is they want you to send the medical bills, and first of all, I have to tell you, the other side writes one check and only one check at the very end. They don't pay for your medical bills as they come in, but if you were to send them the medical bills that came from your health insurance, this is called an EOB, stands for an explanation of benefits. And if anyone has health insurance, Medicaid or Medicare, you've seen this. And so essentially, this is a true billing. From Swedish to my client, $29,000, went to the health insurance. Health insurance says, normal and customary, we reduce it by $20,803, and the amount that's covered by the plan is $8,500. If you would have sent this to the other side, right? They'd go, oh, great, thanks, Chris. I'm going to pay you the $8,500.
Of course.
Right? Now, let's get into the words. Collateral source doctrine. What that means in Colorado is if a collateral source, namely your health insurance, reduces a bill, the other side doesn't get to see the reduction. The reason why? You've been paying for these health insurance premiums, not the bad guy that ran into you. So don't send it to them. As a matter of fact, I'm going to show you, right? Here's the real EOB. If you can see that. And then I'm going to walk up just a little bit. An attorney will send out, and it says it's redacted.
Mm-hmm. So you can't see it.
You're covering up everything. If you would have sent this to the other side, then they go, great, here's $8,500, when really they should have paid you $29,000 on that one mistake alone. You would have lost over, what, $21,000?
$21,000. That's a huge savings, Phil.
That's only on one medical bill.
Yeah.
Imagine all the others. You also get pain and suffering and so forth. Here's something else I want to talk about, right? I said use your health insurance. You actually have health insurance on your car unless you signed a waiver. That's called MedPay. Right?
On your car?
On your car
Okay.
insurance. So it's at least $5,000, and it's automatically on there.
Oh. Okay.
When you go to the hospital, do not give them your MedPay. Because if you did, let's take this example. They'll bill MedPay first. So here's the $29,000. They'll take the $5,000, they'll zap it, and now it's down to $24,000, and you're still going to have a deductible and out of pocket. This is what I want you to do. I want you to use your health insurance, and then you use your MedPay to pay for right here. Client's responsibility, $2,400. So if you get MedPay to a doctor's office, to a hospital,
it's gone.
It's gone.
Yeah.
But here, you get to use it for your deductible. It's so important to use it that way. Protect your MedPay, and here's the reason why. MedPay on your car insurance, they don't adjust a claim, right? Like health insurance always reduces stuff. The MedPay on car insurance, they have $5,000, so they want to pay it as quickly as possible.
Do you ever have to pay that back?
Wow, another great question. So MedPay, you do not have to pay back. Health insurance, you do have to pay back. And sometimes you can use your MedPay to pay it back. It's called subrogation.
Subrogation. So these are all, what is this what we're looking at right here?
Okay, all right, so here's a scenario. Let's say here your medical bills on this one is $29,000. The amount paid by the health insurance was $6,000. Now, when you go in with an attorney, there's a law called the make-whole law, and they have to reduce it by the same amount as your attorney's fees, which is generally a third on contingency fee. So now it's down to $4,000. You use your MedPay to pay off what's owed to the health insurance. So you essentially pay zero, and you get paid from the other side $29,000. I know it's super complicated, but watch this again. Give me a call. I'm happy to run it through. But very important stuff.
Well, it's these little hidden areas that you're going to be helping the client with. I mean, I had no idea you had health insurance on your car. I mean, that's a whole nother that's a whole nother reason. So call Phil to reach Harding & Associates directly, 303-762-9500. You can get a free consultation anytime, and you can find Phil online at hlaw.com. Thanks again to Phil for sponsoring this segment.